I don't know about you guys, but gasoline now over here in our state is going at over $4. How much is it over in your state?
Same here. I filled up for 409, I think, 419.
Should we talk a little bit about that before we go? Nah, we probably don't have much time.
I
We'll
don't
talk,
know. Yeah,
yeah,
we're tight on
we don't have
time, and
time for
I
that.
don't really. It looks
We
like
got
Trump
yeah.
is sort of milking the war, so I think we're going to be sort of stuck with $4 gas price. I mean, eh, the guy, man, the guy was talking about how great it was that gas price was down just a few months ago. Now he doesn't seem to care that gas prices are four
Yeah,
dollars.
It
Guy,
says
man,
kind of deal with it right now. So
this dude.
anyway, I am going we're going to talk about a couple biotechs here. We're going to try to get this done in one session. That's why we can't really do much talking. This is, or we can split it up if we go too long. So anyway, I was going to talk about a stock which I do own. It is called Protara Therapeutics. Okay, the ticker is TARA. Okay, TARA. And what? How did I figure out this? I just actually Dylan, I think, was the one who tipped me off. Think it was probably during the summer. During the summer. So what they are is they normally deal with the top medication is bladder cancer, cancer medication, and they've had really good results with it. Um, it's recently reported 68% response rate in who fail standard treatment, which is considered quote unquote best in class. So in late 2026, a catalyst event is Thrive 3, phase 3 interim results. Um, now, you're not going to believe it. They've got a very good cash runway as well. Okay. They raised 86 million last year, which is quite a bit. And the company also has roughly about $200 million in cash, providing a runway till 2028 based on their cash burn. So
Not bad.
these guys have a very lot of cash on hand in case anything goes right, in case anything goes wrong. Normally, biotech's only got about 6 month runway, sometimes a year. These guys have till 2028. So that's really good.
Not bad. Yeah, I mean, I know someone's got 700 million, but their expenses are through the
Oh,
roof if
their
you want
expenses
phase
are
three
really
trials.
high. Yeah, their expenses are really high. Now, here's the thing. This is a stock I haven't found in biotech very much where there's this much ownership. Institutional ownership, which I don't know, Dylan. I guess I got to ask you, like, what would you say is the average percentage of institutional ownership of small tech biotechs, roughly?
I mean, in my experience, so I've let's say just in the last year, the 100 that I've looked at, so to speak, um, institutional. Are you putting like private equity?
Institution, yeah, private equity, hedge
So
funds.
like anyone who's managing $100 million plus, basically that buys a position, you're considering that institutional capital, right?
Correct,
Like there's a full-time guy that's job is due diligence,
correct.
that category. Yeah, so I would say between 20 to 40% is average in my experience.
Yep, I would say that's about right too. I'd say about 25% or so.
Okay.
This Proterra, 74%
Damn.
institutions are owning it. And that's including names like James Henderson, BlackRock, and Vanguard. So it's not little tiny fly by night places.
But it's still like a pretty micro cap, right? It's like a 300 million market cap or something like that, right?
Yeah, about 300
500
million.
million, 300 million.
Yeah. And the CEO, he has some skin in the game, but not much. I mean, he's got about a million shares, 870,000 shares, or about 1.6% of the company. And he's slightly increased a little bit this year, but hasn't been buying um hand over fist. Now, the
I'm
CEO,
gonna try and keep your face away from the
oh
camera.
my
You're getting a little
Yeah.
close.
My fault. Now, I'm looking at notes. Now, the CEO before he was VP of Head of Business Development and a key member of the executive team, um, key member of the executive team. So the CEO has business experience. So you can kind of see that it fits. Now, the price target, this is the biggest thing. Right now, we're
Oh,
at
my
five.
glasses, sorry.
Yeah, go ahead.
Gotta smarten up here.
Yeah, you're good. You're good. Now, the price target for right now, we're sitting at about 492. That's a 429. Price target, $20 to $25. So
Where's their major catalyst event, like FDA approval or whatever?
yeah. Their major catalyst event is late 2026. The catalyst event 5-3, the phase 3 interim results.
And they're getting
So
they're filing for their bladder cancer, I'm assuming.
correct, correct. So I do own a position at this stock. I think I own it in the four some dollar range ish. So making some profit, but I'm waiting for that complete pop. I have personally never seen a small biocap talk like this with really high institutional ownership. I mean, to me, the only issue is if the institutions bail, you're screwed. But my
Yeah,
opinion,
he
in
got like
my
a
opinion, if anybody,
dollar.
yeah, if anybody bails, though, you're basically screwed. But here's my thing: is that the institutions have the most money, the best brain trust, in this biotech, to have a whole bunch of them. It's not just one, remember, not just one or two, to have a lot, 3 or 4 or 5 of them.
A lot of
I
due
mean, that
diligence.
it shows me that something's cooking. Now, oh yeah, you remember those? What do you call
And
them?
what kind of position would you say this is? This is like a 1% position roughly, or
Oh yeah, it's a 1% position. You know what I mean?
okay, so
It's
you're
it's
not like betting the farm on this thing taking
no, 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 no.
off.
I will ask you this: what did you call? What were those brothers you named again? The what?
Baker Brothers, Baker Bros,
Yeah, the Baker
Baker
Bros.
Bros, like cookies, bakers.
Yeah, the Baker
Well, not
Bros.
cookies, obviously, but yeah,
Yeah,
they're not bakers.
yeah, the Baker Bros. Right? They were in this stock for years, and probably the phase 1 and 2 trials. And they just recently got out because I'm theorizing here when they were getting in at like $1 or two. What I mean? They probably had enough and didn't want to wait for that phase 3. You know, but there's mostly buying positions right now. So, what would I suggest to people? Again, I wouldn't suggest to buy the farm. I think it's very interesting because I've never seen institutional ownership have this much.
Did the light just go out?
Oh no, no, it's still here.
Oh,
Oh
weird.
yeah, yeah. Hold on. There we go. No, sorry about that. Yeah. So yeah. That's very interesting. An interesting proposition.
Yeah, I have a question though. So, are you basically like, what's your conviction with that kind of stock? Are you like a 50-50, like a 80-20? Are you like a 95%? Like what's your conviction or what?
Conviction's pretty high. I would say 65 to 70%. My
Okay, so
conviction is
that's
high.
the why the small position because
Yeah.
it burns
It's
you,
not,
you're whatever.
it's not 100% because nothing's 100%. You know what I
Yeah,
mean?
and nothing's 100%. The sun getting up isn't 100%.
Yeah, exactly. Exactly. So the conviction rate isn't like this is a slam dunk. You have to buy it tomorrow. This is whatever. In fact, I would actually argue you have time because that catalyst event isn't till late. And some like the Baker Bros who got out of it probably just want to put their money elsewhere for other
Yeah, well, they're
causes.
waiting like me with Summit. Like they want to wait till a little closer to the date and then utilize that cash then.
Mm-hmm.
Because the
Again,
market's kind of waiting, so you're like, well, I could get back in at the same price later. Meanwhile, let me put this capital somewhere else, you know? Your light keeps
exactly.
going out. You touching it or something?
I'm not touching it. No, it's
It went dim.
really
Yeah, right there.
there
Keep it,
we
keep
go.
it like that.
I can try. I can try.
Oh,
But
like randomly, and then all of a sudden it goes like dim or like one notch down or something.
oh, it is an old lamp, but um anyway, yeah. So back to it. Yeah. My conviction, yeah, that's a great question. My conviction isn't like, and this is why I probably forgot to tell you about it. This was more of a flyer, you know what I mean? Because I
Yeah, you
like
like
to
to do
own.
flyers. I know. It all worked out, and I think all of your flyers so far have worked out except the ASST, right? I don't know.
That's the only
You're not
one.
done with your position. You haven't exited, but
I
yeah.
haven't exited. Yeah, AAST, I guess we can talk about it. It's basically a Bitcoin um play,
Holding company
obvious.
play. Yeah.
Yeah,
Leverage
it's
mining,
it's a
leverage
bit
Bitcoin.
yeah, it's a bit it's actually been probably one of my worst rolling of the dice is actually. Yeah.
Your light just went dim again.
Yeah.
Whatever. It's
Yeah.
just I don't want to keep
It's actually
pressing
probably
about it.
what, yeah, there it is. It's going dim. It's actually one of my worst positions actually in terms of just just um
Performance.
just that's it. You know, I mean, one of my worst positions in terms of rolling the dice. Why? Because I was thinking that Bitcoin, once it hit about 95 to 100K, it would bounce back up to that 120. Now, what are we at now? I think we're at almost 80, aren't we?
High 70s. Yeah. 78, 79.
So we may get back to that. And I've only held the position since December. So let me just say, I haven't sold. I'm not panicking in that. So yeah, that's all I want to say about Protara. You know, I mean, if you want to talk about your biomed, and then we can compare, contrast, or do whatever.
Sure. I guess I'm just wondering if any have any questions on Protara. I know that Aura is also doing a bladder cancer cure, but they're far away from phase 3. So, and they have probably a completely different mechanism of action. Um, well, have you looked into the competition in terms of like who else is in the space? Like, do you have an estimate in terms of what their sales are going to be after FDA approval, or
Yeah, great question. Their
just
competition.
ballpark? Is there 100 other players? Like
Yeah. Their competition is basically Immunity Bio and Johnson and Johnson. They're in Lexio. So they've got some competition. You know, they've got, it's not like they've got a monopoly. Um,
you're shaking the keyboard as you type. You're
yeah.
shaking
Yeah. I'm sorry. Sorry. Sorry about that. So,
Gonna be one of our best episodes.
yeah, not one of our best, but yeah. So they're doing with the rare disease play with the lymphomatic malformations, which is kind of like a niche play, which is premium pricing 100,000 to 300,000.
Who is they? This is Protera again.
Protara, yeah.
So they're not only doing bladder cancer, they're doing something else.
They're also doing lymphomatic. Yeah, they've got they've got two different things. There's Terra 002 and for bladder cancer and lymphomatic, correct.
What's the mechanism of action? Like the basic idea.
Basic idea is, oh, you mean in terms of what
How does
the
the drug work? Does it have fairy dust with unicorn like horns, or like?
yeah. Well, one thing I can tell you, I don't have the exact mechanism on the second drug, the lymphomatic. I'm kind of more interested in the bladder cancer because
Yeah, that's the
it's
immediate moneymaker, but like,
that's the money. I not 100%. That's the one I think that the people are. That's the bread and butter. That's for
yeah.
sure.
Do you know you want to talk about the mechanism of action for that drug?
Well, I would, but I don't have the information right
You did
in.
look it up though, right?
Yeah, I did look it up. I don't have it.
Okay, cool. I'm like fairy dust.
Yeah.
Let me guess. Fairy dust. Big
Yeah.
trials.
Yeah.
Mechanism of action. Basically, we just really pray hard and they get better. That's what
Yeah.
we're patenting it.
Yeah. Exactly. Exactly. Um, so the I'm kind of doing it on the fly. It's the TNF alpha and IFL gamma. These directly attack and shrink the abnormal cells. Okay. They also got the IL-6, IL-12,
These
nitric
are things that are
oxide.
like attacking the cancer cells, I'm guessing.
Exactly. The shrink abnormal cells. And these recruit the killer T cells. Okay.
Mm-hmm.
So in bladder cancer, Terra 02 kills some tumor cells directly, which releases the tumor antigens. Okay. So then the immune system sees these antigens, learns, and attacks it.
Is this injected into the bladder? Is it oral? Like, what's the mechanism? Like, is there a little bit more about the mechanism of action here?
Mm. Nutritional restoration.
I thought it killed the cancer. Is it oral or is it injection?
It's oral. It's oral.
Okay.
Yeah.
So once a day oral, whatever, something like that.
Yeah. Exactly.
Okay. Yeah, I have a lot of questions.
Yeah.
On
And
my watch list, but
unfortunately,
like I want to make sure I have a pretty good grasp of
yeah.
what the going
Yeah. This is
on.
my part. This is an injection one of them is injection. The other one is infusion.
Oh,
Yeah.
which one's the injection? Is that the one that's the bladder
So it
cancer?
has,
Like just localized?
yes, hold on. It's weird. The one for cancer, right? Liquid, and is a catheter wash. That's the bladder. The other one for the lymphatic is an injection. So that's how I got confused.
Okay. So catheter like in the inserting in the bladder, like male through the penis and
Yeah,
female through the oh boy.
exactly.
I don't think I'll be signing up to that. I think I'll sign up to Aura's bladder cancer.
Well, it depends. I mean,
Well, actually, they do the catheter as well. Now that I think about it, so yeah, they just don't.
well, when you
Uh,
think about when you have to, when you're gonna die, um, you're gonna go
is that
after.
worth it? Yeah,
Yeah, is it worth
probably.
it? Probably. So
Yeah.
my apologies for not having all that information. I mean, all the nitty gritty of it.
Shame on
Um,
you. I was expecting like your homework done.
well, I was see. I guess what I'm getting at with this is that I'm not saying you don't do your homework, but normally I'm using the whole letting the other guy. I'm copying the hedge funds home. I'm copying the hedge funds homework, the different hedge funds. I'm
Okay,
putting
you're outsourcing your due diligence a little bit to
outsource, well,
the big
especially with something
boys.
like this, I can outsource more due diligence in
You're
terms
doing
of
a small position, so if they're, totally wrong, then you go, okay, cool, fine.
exactly.
Okay. Yeah, not my style, but you know what? There's a certainly a valid point to maximizing your time efficiency. So
Mhm.
yeah. Okay, cool. Yeah, we can talk a little bit about the one that I've been all into for the last week and really excited about. So yeah, let's talk about that now. I won't be able to do a full episode on it. I put about 50 hours of research into it, so I'm very familiar with the people involved and the mechanism of action, the funding, and all that all that jazz. So yeah, I'm very interested. I'm going to be doing I have a small position and I'll be increasing my position in it. And the stock is called Biomea. BMEA is the ticker. Um, and it's a diabetes cure, not treatment, cure. And that's what kind of makes it pretty exciting. Um, so the basic cause of diabetes is the beta cells or the yeah, beta cells, isolates, I think they call it. Anyways, whatever. It's certain cells that produce insulin in the pancreas. They're called beta cells. I think they normally refer to them as the isolates or something like that. Anyways, the point is these cells that produce insulin in the pancreas, they get weaker and weaker and they produce less and less insulin, kind of wear out, so to speak, prematurely. It's honestly probably related to poor diet, and then genetics as well. If you had a perfect diet, they would probably never wear out, But even I know I'm supposed to eat a perfect diet. I still don't eat a perfect diet. Like I had a sugar drink just a little bit ago. So like, I don't have to say. Like I know how important it is to eat healthy and everything, but I still don't do it. So it's just realistic. People are not going to be eating perfect and all that jazz, and so we just need to deal with it. With drugs and treatment and all that. So their mechanism of action basically is there is a substance, I guess to say, lack of water, lack of I think it's like technically an amino acid called menin that women when they get pregnant they actually downregulate menin in order to increase beta cell production because their need while they're pregnant for glucose goes up. So they basically produce more beta cells to keep from getting gestational diabetes. They keep the glucose level under control, even though she's eating more and her glucose levels could possibly go too high because she's one mouth for two people basically, and one of them is growing very fast. So this is a natural mechanism. So this drug does the same mechanism action that a pregnant woman does, where it downregulates the menin, and then that allows the beta cells, or tells the beta cells, however you want to say it, to basically start growing and proliferating and get stronger and start producing more insulin. It sort of mimics the natural human reaction because it works with men and women. It's the same mechanism of action. They have the same biology, basic biology, basically. But the women automatically turn on when they get pregnant, generally speaking. So that's the mechanism of action. It's had no large scale tests. The largest number of test patients have been about 60 patients. But all the tests, but the main thing that's really interesting is the tests basically show that they'll do a treatment for like 4 weeks or 8 weeks or 12 weeks, and they'll stop. And their HB1C, HB1AC, the measure that's used to measure if you have diabetes, the blood sugar in your blood over the last 3 months, which is supposed to be under 7, that goes down, continues to go down after they're off the medication because the beta cells live for like decades. Like it takes them a long, like, like blood cells, they only, like red blood cells live for maybe like, 3 months or whatever it is in that ballpark before they die. Beta cells live for like decades before they die, more close to like a nerve cell, which lives, for your whole life. It's the, 100-year cell basically. Beta cells are not that long, but they last for a very long time. So somewhere in the order of decades. So that therapy should be, because you're allowing these cells to get stronger, and that should give you like 10, 20, 30 years of no diabetes, basically. It should be like that, sort of like restoring using a natural mechanism. You don't have to go in there and inject stem cells and worry about the immune system, because there is another company that's actually doing that where they're doing stem cells. But the problem is the immune system then, well, I don't know if they're doing it exactly in the pancreas. So just, this is something that other biotechs are doing, is injecting stem cells to restore organs that are damaged or hurt or whatever. And the problem is you have the immune system basically that whole, and you have to take immunosuppressants, and that's a issue, complication that patients don't want. Ideally, they don't have. This is using a natural mechanism of the body to basically restore that themselves, and that should be cured. Now, they don't have any long-term tests, like testing anyone 5 years later, at least not that they publicly released, although they started doing trials, and like earliest trial I could find was like late 2022. They enrolled the patients, and then they had pretty good results like a year later and stuff like that. But it would be great if I would love if they could release data on patients they had from 2022, and then got the numbers for how they were doing right now, meaning like years later, how is there, but they haven't publicly released that, unfortunately, because it would be great to get some longer data, and then obviously have 1,000 people take this drug that are all have prediabetes or diabetes, and see, what kind of numbers they get. But that's down the road. They need to basically get some good phase 2 data to raise more funding, or get a loan or a partnership or whatever, so that they can then afford to do phase 3. But yeah, I don't know. That's the initial thing. Do you have any questions right off the bat,
I
Chris?
do actually, in terms of like Tara's a little different because it's bladder cancer or whatever. Like, what is what type of market are they entering into? Like, is this competitive or not competitive?
Yeah, yeah, it's a very lucrative market. Now it is much more lucrative because it's a treatment or a maintenance market. This would be sort of like a one and done maintenance, so there's a little less money in that. So that is a downside to the company, is that the big boys that are making, hundreds of billions of dollars, making insulin, and making, not that they're going to go away, but a lot of their business potentially is going to go down off of this drug, because this drug works with regular diabetes drugs. It works with um, different types of diabetes. You have like the more of a sort of insulin resistance diabetes. It helps with that. It's not doesn't really help that much, but does help a little bit. It has like virtually no side effects. But it really helps with the people that have that the main issue with their diabetes is not that they don't that they're but sorry, earlier I meant to say insulin resistance. It really helps with the patients that are not getting enough insulin, that when you inject them in insulin, they get a a good response. But the problem is that when you're injecting it, or if you have like another biotech has like a little like automatic AI injector to basically like an artificial pancreas basically that's injecting. Problem with that is the pancreas already does it automatically. You don't really need you just need to sort of restore it and then you're good. You're young again, so to speak. Your diabetes is gone. Is a little more convenient than having a little like thing in your arm. This is sort of the no side effects, natural, like relatively cheap. But yeah, there's a downside because a lot of people they're gonna make probably a decent amount of enemies.
Yeah,
So there's stuff.
I think the space is more crowded. That's what I'm saying.
The space is definitely crowded. And yeah, they're gonna make a lot of step a lot of toes if they're to start taking that market share basically. And if you had a company that was doing $10 billion a year, like a Johnson & Johnson or whatever, in diabetes medication, you would not be thrilled that all your patients are getting off of that, taking this drug, being cured, and walking away. Regardless of how good of a person you are, you just don't want to lose that $1 billion or $10 billion of revenue, a year. It's just we
Okay.
should obviously work on replacing it somewhere else, but the reality is people are gonna, have issues with them.
What percentage of insider ownership?
7%.
Okay. And then
That's what it posts on Yahoo. I think it's a little higher than that. It depends. Yeah, depends on how you count it. The CEO left last year, but he has 4 million shares he hasn't sold. And then the other insider, major insider, the other co-founder is still there, and he's got about 2.5 million shares. And then there's a corporation that was because it was a private company that's still there that owns a lot of shares, and I'm not exactly sure, you know, who owns that corporation basically. And it seems like they both split it. The two co-founders are splitting that corporation. The corporation owns, I think, about off the top of my head, about roughly 3 million shares.
okay, okay, cool. Cash burn? What's your cash burn?
They have 1 year cash, so or 9 months probably at this point. First quarter of the number. The cash burns probably like 40 to 60 million a year, something like that.
Okay. And then what about institutional? How's their percentage?
Not a lot. I mean, Fidelity owns 12%, so that's one, vote of confidence. The Baker Bros sold, just to be honest. I don't know that they have any huge catalyst events coming up. They also have, in addition to diabetes drug, they have like a Ozempic or whatever, like a weight loss drug. And it can work because the mechanism of action kind of works with everything else. It can actually work with the this is weight loss, the GLP-1s, the Wegovy and the Ozempic. Ozempic is the main one you hear about. They can work with that, and they have a test trial that's going with that. That the results are coming out second quarter, and so I mean we'll see on that. I don't really think I think it's a long way off from making any money from them, but it's just sort of a thing that they thought they could kind of see how it goes. And their numbers look fantastic. Their main thing on that is basically when you take Ozempic or one of the other ones, you lose muscle mass. You lose fat, but you also lose muscle and possibly bone with their drug. Or either I think they're testing it in combination, but it could have been just when they do it alone. But either way, when you do
Yeah,
their
and that
drug, their weight loss.
sorry to interrupt. And that was what I was getting back to my first question. And by the way, I own this. I think we spilled the beans.
Oh
We
yeah, yeah, yeah.
we,
Disclosure.
we both own small positions. I think my biggest thing is that the biggest competition with this, which is why it's a little different than Protara, um, that they're entering a space where Elon,
Eli Lilly.
yeah, Eli Lilly and Novo Nordisk are big time players. So
Yeah, I don't think that's
why
really
is
a
that
lot of value
important?
in the company.
Yeah,
Yeah, the weight
why is that
loss.
important? You're gonna have to get them to switch, right? From
Or add, obviously, but yeah, but
you
it's
know what I'm
gonna be
saying?
tough. Yeah.
Yeah, you're gonna have to get them to switch. That was kind of my only hesitation. Oh, and by the way, there is a catalyst, but I think their earnings is about a week, May 5th, I think.
Yeah, I don't know. I mean, sure. Yeah, that's a potential catalyst. Obviously, the clinical data is much more of a catalyst than the we lost, another 12 million this quarter, which
Oh yeah,
is
it
like,
depends on their cash burn though. If their cash burn's high, right?
Yeah, it's true. They can affect it.
Yeah.
Yeah, yeah, yeah. Their
Yeah,
cash burn,
right.
they
So
already
yeah, that's what I'm
announced, they
saying.
already slimmed down. That's
Yeah,
one of the reasons why they got rid of the CEO. The CEO wanted to also run cancer trials. They were doing cancer trials before, and they just couldn't. They didn't have enough money to do everything. So they're like, look, the diabetes is something it's think about it right now. If you're on diabetes now and you're like you're potentially looking at doing insulin and you got all this fucking stuff going on, and it's really not a great experience in diabetes. If you know anyone that's on diabetes, that has diabetes, it's not a great thing. So this thing is like so much better than what's available right now. That's I feel like the main selling point on this company is the GLP-1. It's got major issues. The cancer thing, I didn't even dig into the trials. They discontinued them. They didn't have any money for that. They might pick it up later when they're when they're a little more flush on cash or whatever. But I don't really see that being anywhere in the next few years. Any sort of news on their cancer trials or whatever. The GLP-1, I think only if it's supposed to come out in second quarter, only if it has like blockbuster numbers. This quarter they have the first, I think, 6 months of data on that. If the guys lose 15% of body weight and their lean mass is great and everything looks great, then yeah, they'll probably do another trial and see if they can replicate those results and kind of carry on that way. But I'm not really valuing the company on that. I feel like the diabetes thing alone is, it's a huge market, and I feel like it's such an easy sell. Like, imagine if you're trying to sell somebody this drug if it's FDA approved. Like, look, you take it for 3 months and then you don't need to take it at all, and your diabetes is at minimally better for the next 20, 30 years. I think it's like a no-brainer. It's like, where do I get it? It's like,
right.
you know, so much better than the other options. It's just it's like an iPhone compared to like a landline,
Let me tell you this: is that do you know anything about the CEO?
Mitch Hickok, yeah.
Yeah,
Australian guy, Gilead,
yeah.
Crystal Mile Squibs, yes. Yeah, pretty impressive guy,
Impressive.
actually.
There is one thing I don't like about it, and we don't have
Okay,
much time. We got about
I
three or
know.
4 minutes. Do you want me to say one thing
Go
I
ahead
don't
and
like?
say, yeah, yeah. We'll do maybe do full video later.
Yeah, the one thing I don't like is he's going from a big company with a lot of money and a lot of capital, et cetera. You know what I mean? Elon Lilly, et cetera, to a micro cap company. So if you look at it like a CEO of a big time, I don't know, Walmart or whatever, going down to like a mom and pop shop and now become like he
That
has
doesn't
no
look
for
so
real,
great,
he
does
has the
it?
knowledge, right? But does he really have the um, you know, headspace, I guess, whatever you want to call it, to take. Yes, he can keep a big company big, and he's got the experience to know what to do when you're big and the trials and stuff. But can he manage a small little sailboat and make it big? Make sense?
Yeah, that's a good question. Can he? We don't know.
Yeah, we don't know. Yeah, we don't know. We don't know. I mean, I'd rather have somebody with experience